Thank you. Senator Siewert.
Thank you, Mr Acting Deputy President. I rise tonight to talk about a critical issue for all Australians, and that is mental health. It was with great pleasure that I added the mental health portfolio to a number of my other portfolios, but I would like to acknowledge the work done by my colleague Senator Janet Rice and, in fact, her predecessor, Senator Penny Wright, both of who've done absolutely sterling work in this particular portfolio. I really was pleased to take the mental health portfolio over again. I had it previously and thoroughly enjoyed that work and believe it is an absolutely essential element and issue that we need to be addressing in this country. Of course, last week we marked Are You OK Day on September the 8th, and then on September the 10th, World Suicide Prevention Day. Both these days are important to raise, again, this very critically important issue. They recognise the tragic impact that suicide has across Australia. Suicide statistics show that it is at the highest level in 10 years. It hasn't fallen in 10 years, so clearly more needs to be done to address the issue of suicide. There were more than 2,000 deaths from intentional harm in 2014. That is the latest available figures. Having chaired the inquiry, or one of several inquiries into mental health by the Community Affairs Committee, we also looked at how important it is to get accurate statistics, and I think that we still have some work to do there. And I was really pleased that the Senate supported a motion yesterday that called for a suicide reduction target. Suicide impacts across Australia, and one of the particular areas and groups of people that is affected by suicides, and that is Aboriginal and Torres Strait Islander peoples. This is a tragedy across Australia, and I particularly know that in Western Australia, particularly in the north, we have absolutely tragic levels that need urgent investment. And I have spoken in this place before about the distress that the government has failed to commit or spend the money that was previously committed to address the suicide crisis that is happening in the Kimberley and is continuing in the Kimberley. I'd also like to take a moment to say that anybody listening at the moment, or in fact reading this later, and that if this brings up issues for you, to call Lifeline on 131114 or any other of the excellent services like Beyond Blue or Headspace, and their numbers are readily available. Having taken over this portfolio, I've been consulting many organisations working on mental health to find out where we're at in more detail in terms of mental health. And it seems while there has been some progress, we also still have very, very significant issues to address, so it's sometimes 2 steps forward, 1 step back. And the sector talks of the mental health sector being facing unpredictable change and uncertainty. And certainly, when I've been talking to people over these last couple of weeks, that's certainly the conclusion that I would draw. We know that there are many steps that need to be taken, and many of the things that are being called for, some are not new. However, there are some. There is consistent concern expressed about the future of community mental health services, and I'll come back to that. There's a call for targets and indicators as recommended by the National Mental Health Commission when they released their report last year. There's deep concern that there has been little progress on the 5th National Mental Health Plan, and in particular getting a draft out for consultation, and there's a great deal of uncertainty over that, in light and particularly given the government's commitment when the Mental Health Commission's report was released about the starting of that process. There's concern over investment, and again I'll come back to that, particularly in early intervention and prevention. And there needs to be certainty around grants and funding to avoid disruption for providers. And again, the same old is that providers are unsure of ongoing funding. There's also a need to make sure that the primary health networks are supported in the vital role that they have been given in the provision of services. And to also make sure that the primary health and clinical services have the complementary community mental health services. Despite clear requests and advocacy by the mental health sector, as the National Mental Health Plan seems to be still in limbo. This is, of course, the 5th National Mental Health Plan, and it's vitally important that the progress on this is commenced, that there is extensive community consultation with all stakeholders. It is critical to ensure that we have adequate care across Australia, and this plan plays a vital part in that. What distresses me a great deal is that, having had this portfolio previously and been heavily involved in lobbying for more expenditure on mental health, and although there has been some additional commitments, it's distressing that in fact spending per capita is dropping. And there is particular concern around expenditure on community mental health. It's essential that we make sure that we have significant investment in mental health if we are going to address mental health and see significant progress. One of the areas that has also come out consistently when I've been talking to people over recent weeks is the mental health and how it's sitting with the National Disability Insurance Scheme. Now, I don't for 1 minute want anybody reading or listening to this to think that we don't support the NDIS, because we are strong supporters of the NDIS. But one of the issues that, as I said, has been raised consistently with me is now how mental health is being addressed in the NDIS. And what happens to those people that in fact don't get packages? And what people are finding is that looks like people are not going to get the same level of support they may have in the past, because programs like Partners in Recovery and FAMS are being wound back. And so those vitally important services will not be available, potentially, for people that don't qualify for a full package under the NDIS. So the other issue that goes hand in hand with those programs being wound back is that some states are putting all their funding into the NDIS and are not supporting community health services and other services that support people that don't qualify for the NDIS. I think the figure is 12% of people with mental illness is foreseen will qualify for an NDIS package. And there simply is not enough funding in what was commonly called Tier 2 or the LIC component of the NDIS to support all those people that don't qualify for a full package under the NDIS. This seems to me, in my consultation, to be raising increasing concern in the sector, and I think urgently needs addressing by the government. Because certainly some of the figures that I'm hearing is that some figures can be slightly misleading in terms of the number of people that suggested are actually getting packages. Because some of the figures that are being used are talking about the number of people that have actually got a package, that applied for a package. But when you look beneath those statistics, there's a large number of people that didn't in fact apply for a package in the first place. So some of the figures, I'm not saying are deliberately misleading, but can be misinterpreted to the point where they are misleading in terms of the number of people that are in fact getting supported through the NDIS. I'll say again, I'm not having a go per se at the NDIS, but it's the way that outside the NDIS, though, people are being supported. This needs urgent action, urgent attention before it's too late.